We're an old state and we're getting older. Somewhere along the line in that equation, we're going to need more people to take care of us as we get older.
So we focused on caregivers. There's going to be a national shortage.
Sarah Rahal, The Detroit News, Ted Roelofs, BridgeMichigan. Reporters. They looked into the world of home health aides, caregivers on the front lines with a collaborative media investigation into the massive shortage of these specialized workers.
And it's compounded by an issue that's been there for a long time, which is really substandard pay for this kind of work. So it's hard to attract and retain people to do this over time. And COVID-19 has only made things worse.
The industry had an estimated 82% turnover rate in 2018. Another estimate, in Michigan we're short 34,000 workers out of a workforce of 120,000. 5 years from now, a shortage of 200,000 workers as our aging population keeps growing.
Were you surprised with what you found?
No, frankly, I've been reporting on issues touching on this for quite some time. And it's one strand of many that Michigan's been dealing with for a while.
With wages averaging $13 an hour, fast food workers can make more. To get enough hours, caregivers need to travel to multiple clients.
90% of people would love to stay in their own home and grow and die in their own home.
But in many cases, that process is only possible at some point if someone can come in the home and help with basic needs, in some case, greater needs.
But a lot of people have turned to nursing homes, which have taken a very hard hit during the pandemic, and nursing homes have just not been an option for many people.
Some people need help just with cooking and cleaning. People need help bathing, maybe getting up in certain situations. Without someone to do that work, and people are forced to leave their home when they really don't want to. So this is a vital part of our workforce.
It's not always just taking people to the grocery store and getting their groceries for them or helping them to and from places. It's feeding them, caring for them, being there for them when their family isn't, and being a part of their family. And the caregivers that we talked to felt more stress than ever.
Direct care work can be dangerous, not just the risk of COVID. Moving and lifting old disabled people can cause injury.
Detroit was so much different. There's 1 in 5 caregivers lack transportation.
Car insurance costs, mass transit struggles, child care issues. But now, because of the pandemic, the government provides battle pay of sorts.
We've had a temporary $2 an hour increase for direct care workers in Michigan going back into last year, and there's discussions now about extending that out maybe through September. That helps, but that alone will not solve this problem.
Everyone that we've talked to has said that there is a need for a program that works.
1 in 5 home health workers is now between the age of 55 to 64. How long can they keep going?
In Detroit, they want to encourage more people to join the industry when they're younger. And that's one of their outreach solutions, is to reach out to these kids instead of saying, hey, don't go to work at McDonald's, come do a very valuable job that can make a real difference in the world and can really build your resume in terms of healthcare. And it's somewhat working. They're getting a lot of people in the ages of 21 to 28 who want to take this on as a part-time job.
Rahal and Roelofs reports were supported by the Solutions Journalism Network. They've revealed some ideas not much seen in the news until now.
But did you find much coverage in recent years about home care?
We rarely found articles that really dove deep into caregiving solutions and agency solutions and what people were doing that was unique. We really had to dig and hunt for things that we could refer back to.
In looking in this project, we tried to find some concrete solutions. What are some hopeful things that can be done? And one of the things I looked at was there's a cooperative out in New York City that was started, I think, way back in 1985. Basically, this is a home healthcare agency.
The co-op gives aides at least 30 hours a week, pays $15 an hour with benefits. Its turnover rate around 20%. That's 4 times lower than the industry average.
They've been able to piece together foundation grants and other federal, state assistance, and that's not going to be something that's going to be easily done everywhere. But it's a good sign that if you support these people, if you give them good benefits, they're going to be more loyal, they'll be better workers, and they'll stay in the job. Some of the area agencies on aging were doing creative things.
In Bay City, funds were found to help 80 of their workers.
There's one agency that were paying workers a $1,000 bonus if they stayed on the job for a year. That might sound crazy, but this is what they need to do to try to get people to stay on the job. They had success with that.
The experts that we talk to say the majority of people don't want to do the job because they don't feel appreciated. There's just a lack of respect.
Unless we're suddenly willing as a society to say, we value this work so greatly that we're going to increase the pay by, pick a number, $5 an hour, $10 an hour. Well, where's that money going to come from? So it's a difficult issue.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.